Another show, another episode of your favorite program, The League of the Genuine, the only program on the planet that talks to, speaks to, has conversations around counterfeit products and services. We had a big show last week. We were talking about cancer, which is a thing that frightens all of us. But we would like to decode this cancer, and in particular, we would like to understand, is it true that consumption of counterfeits actually helps in the spread or the cause of cancer? Last week, we spoke to the head pharmacist at the Cancer Institute, Mr. Sinde, and based on your feedback, many of you were actually yearning for more, asking us to give more and more episodes covering cancer, because apparently it appears that we know more about malaria, we know more about HIV, but we don't know about this menace of cancer. So we have taken the step to get you the experts who can speak to this subject, and we have had to go to where the experts actually work from. I am broadcasting here in the Cancer Institute, right in the institute. The institute, for those of you who don't know, it is on Mulago Hill within the Mulago Hospital Complex, and I am sitting here on a chair where some cancer patients who are involved in cancer treatment trials and research sit, and with me in what they call the infusion room is a senior oncologist. If you didn't know, an oncologist is also a doctor, but specializing in cancer. I'm learning first some of these terms. We have none other than Dr. Okuku. Dr. Okuku, you're welcome.
Thank you.
You have another name, Dr. Okuku?
Fred Okuku.
Ah, okay. So we have two Freds on the show. One is a doctor, and the other one wanted to be a doctor. But when I grow up, I think I should be a doctor. But we are really grateful to host Dr. Okuku here. He's a very busy gentleman. He has had to stay in late to host us. We thank you for that. Dr. Okuku, for those who don't know you, just tell us about yourself. Who is Dr. Okuku?
So I am a consultant medical oncologist. A medical oncologist treats cancer using drugs, various types of drugs and agents, chemical agents. And I have been associated with this institute for the last almost 16 years now. I like what I do. It's a challenging discipline. We see lots of patients who are suffering, and many times, you know, it can get to your head sometimes when you see people in very serious conditions,
in pain and
suffering, with all kinds of tumors. It's a challenging job, very challenging calling. We call it a calling, but also interesting, and to be able to help people who are in need. So, exactly.
Just clarify a bit, doctor.
Yes.
You said medical oncologist.
Correct.
Meaning you treat cancer.
Yes.
With medicine.
Yes, correct.
But we all know that there is sometimes chemotherapy or
Correct.
Radiation
Yes.
involved in treatment of cancer.
Yes.
But now you're saying cancer is treated with medicine.
Yes, so we have also what we call surgical oncologists. These treat cancer by surgery, using surgery. So cut out the tumors. And then we have radiation oncologists. So these use radiation to treat cancer. So they are also specially trained in that area. They deal with equipment, and those equipment produce certain radiation which is directed to where the cancer is. Then we also have doctors that treat children. We call those pediatric oncologists, specifically treating children. We also have doctors that treat women who have cancer, especially in the reproductive area. We call that oncologists. Okay, like coming from the word gynecologist.
And those who treat men?
Those who treat men, especially bladder cancers and prostate, those urological cancers, we call those, they are still under the medical oncologists, but they are also a fraction of those who are surgical or urology oncologists. Or they do the surgery.
Under cancer, you could have 10, 15 specialists.
Specialists in different areas. And by the way, that also includes those who deal with pain and end-of-life care.
What you call
palliative doctors and nurses. It's another discipline. Their work is to come and deal with the pain, counsel the family, deal with everything in the dying situation.
That looks very much like a specialty, kind of high specialty. Exactly. So do we have enough oncologists here in Uganda?
So we are improving. We do not have enough oncologists.
How many do we have?
We have close to 20 oncologists in the country.
In the institute?
Yes.
In the institute here?
In the institute, in those different categories that I have mentioned. We have the surgical teams, we have those who treat children, we have those who treat adults using drugs, and we have different types. There are those who just treat the leukemias and the lymphomas, we call those the blood cancers. And there are those who treat breast cancer specifically. There are those who treat prostate. And
so we have 20 here.
20
so how many do we have in the whole country?
20 again. So 20 here and then 20 in the whole country. So cancer treatment is...
20 doctors for the whole country?
Yes, that's what we have.
So you mean that on an average of 40 million Ugandans?
Correct.
For 20 oncologists, cancer doctors, we have one cancer doctor to 2 million Ugandans.
Correct. That's the situation. But so I should say that
is dire.
That is improving because now we train oncologists here at this institute.
But why did you wait the population to rise to 40, then you train? What happened?
Well, you see, I think it's not unique to cancer. I think also in other fields, whether it's lawyers, whether it's, I think as a country we have been lagging in many ways. And this is one of the ways we've been lagging, especially in the medical care. But also, cancer is a unique disease, very unique disease. And by the way, just to tell you, although we are doing badly, but we are supporting many countries in the neighborhood.
So our 20 doctors are
also treating many patients coming from the neighboring countries.
Meaning other countries also have a shortage.
They do not even have. Some countries do not even have. Okay? They do not even have a single cancer specialist. So that's how complicated this thing about cancer is. I think that it's a disease that we are learning as Africa and as Uganda. It's something we are learning. Just to let you know that most languages, most vocabularies in Uganda do not have a word for cancer in your vocabulary.
Malaria, you call it musujja.
Yes.
So what do you call cancer?
It's not there. People have begun coining names. For example, in Swahili, cancer is called saratani. In Uganda, they coined a word called kokolo, but I'm told kokolo is a wound that does not heal. So it's not exactly...
So it's a new thing in our lingua and in our system.
Exactly.
So that's why, would you say, that's why we appear to be losing the battle against cancer?
I think we had never even started the battle against cancer. We're just beginning now. We didn't have the infrastructure. We're just beginning to build the infrastructure that treats cancer in the modern way. Previously, this center majorly treated cancer using medicines, called that chemotherapy. That's how this center was set up. But over time, cancer is treated using different methods and different strategies, including radiation, including biological therapy. Now we are using immunotherapy to treat cancer. That's something that never was there at all. We now also use hormonal therapy to treat cancer.
Those are really, I'm
Yes.
sure those are good developments. But
Yes.
you see, for an ordinary Ugandan, if they hear that we are just beginning
Yes.
to fight cancer, and yet we've been having a lot of corporate social responsibility activities, including the cancer run. So many people participate every year, and we hear millions and billions of shillings are raised. So why do we run about something we've not even started to treat?
I think that our response now, and also the human resource, at one point, by the way, there was only one doctor treating cancer in Uganda. Only one
At one
trained
point,
doctor at one
that
point.
must have been in the 50s.
Not very long ago.
How long
But,
ago?
that's about maybe 20, 15 years ago. There was one
That
doctor.
is recent.
Yes, at this institute, one doctor was treating cancer. So
Who was that?
That was Dr. Mbide. For
Dr.
many years.
Mbide.
Yes, for many years.
Is he
Dr.
still here?
Mbide. He doesn't work, he's retired. But that is how severe things were. So, but I think our preparedness is now much better. But from 1 to 20, so you can see that jump. I think we are getting prepared. And of course, you know that we are also in the expanding to regional centers. As I speak now, we have 2 centers outside Kampala. We have Marara, which has been running for, it has over 2,000 patients there. And then recently, Arua is coming on board, and then Gulu will be coming on board, and Mbale will be coming on board. So those to cater for those regional areas. We have a small center running in Mayuge. By the way, Mayuge was chosen because it used to have the bulk of our patients. Most of them used to come from Mayuge. That's why they put a rural center there. And the aim of that center is to sort of study cancer at the rural level, try to understand what.
Did you find out why Mayuge?
That is ongoing. Yeah, and sure, in a few years we shall be able to understand more about cancer and the rural setting. But Mayuge is one of those districts that was chosen because it had huge numbers of cancer patients coming from there.
Which type of cancer was coming from there?
All kinds of cancers, including cervix, including Burkitt's lymphoma, and other types of cancers.
Wow.
Yes.
Viewers, we are in the Cancer Institute because we are building a partnership to try and do many things, including, among others, to study whether there is a relationship between the use and or consumption of counterfeits, whether there is a relationship to the increasing number of cases. Now, you don't have to take my word that counterfeits cause or contribute to the causes of cancer. We need to put this question to you, Dr. Okuku. People
Yes.
out there are asking, but Fred, is it really true that counterfeits, if you consume counterfeits, it can lead to cancer?
Very true. Very
How?
true. And you know, each time you talk about counterfeits, I begin to fear, you know, what is going on within the country and outside. I'll give you an example. We have a cancer that is associated with malaria in this country. It has been here for ages. That's called Burkitt's lymphoma.
Burkitt's
Lymphoma,
lymphoma,
yes.
a cancer associated with,
With
malaria,
malaria.
meaning it's caused by mosquitoes.
Not directly, indirectly, and this is how it happens. Frequent infections with malaria parasite leads to triggering of this cancer in children, especially children who are below 5 years. Okay? So for example, if we supply fake anti-malaria drugs. A child who suffers from malaria takes a fake anti-malaria drug. So the malaria does not get cured on the treatment.
Which fake anti-malarials are common on the market?
Correct. The child will, the malaria will sensitize what we call the B cells in that child's body. B cells are cells that help in your immunity. So those cells are sensitized.
Meaning what?
So
they are affected.
They are affected in a way that they no longer function normally. Okay? So they acquire an abnormality. And then that abnormality is the one that leads to proliferation or abnormal multiplication of those B cells, because this cancer that we're talking about is associated with abnormal proliferation of B cells. And
abnormal growth.
Yes, abnormal growth. So frequent infections with malaria parasite in this child who is being treated with a fake anti-malaria eventually triggers these cells to start multiplying abnormally and triggers the cancer,
which is called Burkitt's lymphoma. And how does it present, that cancer?
So it is a cancer that it's the fastest growing cancer. So we call that the doubling time. In other words, if you have a cell of that cancer that is this size, in the next 8 to 16 hours, you have another size of cell like this. So in 4 weeks alone, that cancer will be exploding, and it usually it loves the jaw. So it usually grows in the jaw.
Oh.
So the teeth will be falling out.
Those cases you see children with.
Exactly, swollen jaw, swollen eye, swollen mandible. And the child cannot eat, the child cannot breathe. If that child does not seek care in 4 weeks, we shall lose that life.
And this is from a counterfeit anti-malaria.
Secondly, if the bed nets that are being supplied to these children affect the mosquito, or the longevity of that bed net will not protect this child. So the malaria parasite or the mosquito will bite and transmit the malaria parasite to this child. This child will suffer from malaria, and that will trigger this cancer we're talking about.
So the fake mosquito nets,
yes,
are a causative factor
can
for
lead,
malaria leading to
Burkitt's lymphoma, the cancer.
Oh my God.
So that is how counterfeit drugs and bed nets can affect and lead to cancer.
Is it only in malaria?
It's wide. It could be pesticides. If you receive a fake pesticide, some pesticides are known to actually contain carcinogenics. These are compounds that lead or can cause cancer. We call them carcinogenics. So if a pesticide contains a carcinogenic, and this farmer in the village, innocently, and you know how our farmers do not cover themselves
when they're in the garden spraying.
Yes.
Sometimes they have a child.
Exactly. So, or if he's putting on a fake mask. So while he's spraying, he's sniffing in or he's breathing in the pesticide, which has a carcinogenic agent. Eventually,
what are some of those chemical carcinogens in pesticides?
So we have plenty of carcinogens, and these, we refer to them as hydrocarbons in the carcinogens. They are compounds like radon, arsenic. All these are being used as pesticides, and they are found in many of these.
I thought arsenic is a naturally occurring from the ground, and it contaminates water.
Yes, but it's sometimes counterfeited in these pesticides. So because there is not good regulation in most of our settings, we don't have a lab that can test this pesticide when they're being imported. So somebody can import a fake pesticide that has carcinogenic agents. No one will even know. As you're aware, we do not have that capability in terms of labs that can check this. So that's how fake agents, whether it's agricultural inputs, can lead to cancer. Also, we have the commonest cancer in Uganda among women is called cervical cancer. The cervix is the mouth of the uterus that holds the baby. So the entry to the uterus is called a cervix. It's the commonest cancer in most African countries, including Uganda. In Uganda, we have almost 4,000 women who are diagnosed each year. Okay?
And what's the mortality rate?
It is almost half of those die within 1 or 2 years.
Oh dear.
Now, we have a vaccine that can prevent that cancer. That vaccine should be given to young girls in primary school before their sexual debut. In other words, they should not have been infected by this virus that causes cervical cancer. So the virus is called HPV, human papilloma virus.
They are vaccinated as babies.
Yes, they usually
like for
young,
polio and all those things.
Not really babies. They should be about primary 5, around there. That is the target age, around 9, 11 years. Those we believe have not yet had intercourse, so they are not exposed. So if you supply a fake vaccine to protect those young ones and it doesn't work, what will happen? Eventually you bought the vaccine, but you still have the cancer because the vaccine
And
is
do we
fake.
have incidents of fake HPV, that vaccine?
Because we do not have the ability, by the way,
To even know whether we have.
Yes, NDA is just putting up a lab. I think you've seen on Buganda Road, there's that lab that we expect will help us to monitor our drugs. But what has been happening, we didn't have a lab. What has been happening? Only God knows what has been happening in the drug sector, because we didn't have a lab to check. We don't have a lab to check these agricultural chemicals. That's why you've heard of a lot of fake chemicals. Still using drugs. Recently, there was a drug that was restricted. We used to use it commonly here. In all the hospitals in Africa, in Uganda, its work is, it's given before chemotherapy to prevent nausea and vomiting and some reactions.
For pregnant women?
No, for all other people. And so we used to give it here before chemotherapy. That drug is called ranitidine. It was recalled internationally, world over. And the reason was that it contains a cancer agent only if it is stored poorly. Okay? If you store it well, you won't receive that. It will not transform into the cancer agent. But if it's put in the sun and the temperature goes beyond a certain rate, then that chemical in there will transform into a certain compound that is known to predispose to cancer. So it was banned on that basis.
Because of
Yes.
propensity for poor storage.
Exactly. So how do counterfeit people bring in drugs? First of all, they conceal them. Okay? So the guy can pick a drug like that and conceal it, put it in the engine. So what happens? The temperature of the drug goes up and the agent eventually develops, because for it depends on the temperature, how it's stored. You store it wrongly, then the chemical in there transforms into a carcinogenic agent. So counterfeits are usually brought and stored or transported in a very unhealthy,
Unethical,
unethical, unprofessional manner.
storage. So somebody listening to you can think that in your profession as doctors, you are basically dealing with poisons. These medicines are poisons.
Yes, indeed, medicines are poisons. But there's a saying that says that to a wise, poison is medicine, and to a fool, medicine is poison. So that is a wise saying in medicine. In other words, a foolish guy can have a drug, but because he's foolish, he does not know how to use it properly. He will use it improperly and it becomes poisonous to him. Whereas a wise guy can use a poisonous drug and it becomes medicine.
So in this case, in respect of counterfeiting, you are saying counterfeiters are not wise
Counterfeiters,
in the way they handle the medicines.
yes,
They are foolish, actually.
It is a foolish thing. It's a foolish thing, you know, because they themselves can actually be poisoned by those same drugs.
But do they even know?
They probably don't know. A genuine drug can turn, if a genuine drug can turn poisonous to your health.
Then what
What
about
about
one which was fake?
Fake.
From the very beginning.
Exactly.
Aye.
That's how
But
dangerous it
a
is.
lot of this information is not known out there. Some people think maybe we are making up
Of
these
course.
issues. Why don't you leave people to find a way of surviving? Life is hard. We have found cases that we've handled of fake sanitizers.
Yes.
We have seen young girls, you know, we've done some productions where they are complaining about itching, and then some of the materials that are used for the sanitary pads
Yes.
include pesticides, include.
Oh,
So don't you think this also probably is causing, contributing to the upsurge of cancer of the cervix cases? The
Well,
fake sanitary pads?
This fake sanitary pad can affect and indeed indirectly cause and lead to cancer in this way. One is that sanitary pad, if it's irritating the young girl, and you know the sanitary pads cover the most private parts of an individual. So if it irritates that area, eventually the skin in that area can begin to peel off. And then when the skin peels off, you eventually end up with an ulceration in that area. Okay? So the area is ulcerated, and this should be the outside.
A wound, in other words.
Becomes a wound. But we know that cancers can form from a wound, a chronic wound. So we call that chronic inflammation. So chronic inflammation in a wound can cause chronic ulceration, and then that ulceration can lead to skin, that area of the skin forming cancer. So in other words, if a young lady who is putting on an irritating pad eventually can develop cancer of the vulva. The vulva is, you'd say, the outside of the very private part of a lady.
But that is really putting a lot of responsibility on the manufacturers of these products. These days, anybody will go to China, get a small machine and start manufacturing whatever they want. Don't you feel that the brand owners, the brands that are manufacturing, should do more to explain to the women the dangers of not getting the genuine product from the genuine retail shop, not to leave them out there?
I think we have multiple problems regarding that area, and indeed, as you said, one of the challenges we have is that some of these products are marketed with a very little, I mean, they are very cheap. So our poor, unsuspecting people will go for the cheap product, not knowing the cheap product is actually dangerous. The other thing is we have basically a very poor population here in Uganda. I believe that there are many young girls there who cannot afford a sanitary pad. And they have a way of using some locally made, homemade, pads or something like that. But they are easily drawn to some of these products because, the people selling them are very cheap. Products is very cheap, but also very dangerous. But then the other thing, in the medical world, and this is how we fight counterfeits, you've got to have strong regulatory bodies. In Uganda, we have the NDA. In places like the US, they have the FDA. Almost nothing gets sold without going through the FDA. In here, if it is a drug, it has to go through the NDA. I am aware that we have challenges of regulation, but as doctors we have what we call the pharmacovigilance teams. So all of us are required, when we receive patients who are complaints of side effects or adverse events to any drug, we are required to send through a WhatsApp. You send, even right now with the coronavirus vaccine, we actually sending all the side effects that we see among patients. You send, you say, I have seen this, I have seen this, and so they are sort of
information sharing.
Yes, people are sharing information.
Doctor, from the way you're talking,
Yes.
in relation to the girls or ladies who can't afford to buy sanitary pads,
Yes.
one might get the impression that cancer is a disease for the poor. And indeed, I was reading a report showing that last year about 10 million people worldwide died of various cancers.
Yes.
And the biggest chunk of those, maybe 60% of those deaths, were in the third world countries. Is cancer a disease of the poor, or it affects everybody?
I think cancer is one disease which is unique. The saying is, it knows no race, it knows no clan, it knows no tribe, it knows no economic status, it does not respect age, it does not respect religion, whether you're a witch doctor, whether you are, you know.
One pharmacist told us here that some people think that cancer is actually caused by witchcraft in our communities up to now.
Yes, we have those cancer myths, true. However, it cuts across the whole world. However, we also have certain cancers that we specifically see in a certain group of people.
Like, is there a cancer for the rich?
There is no cancer for the rich.
Or
but
poor?
We see cancers associated with your activity that you do on a daily basis.
For example?
Are you a smoker? If smoking is your activity that you do on a daily basis, smoking is associated with about 11 to 15 types of cancers.
We know lung cancer.
Right from up to down. Lung cancer, bladder cancer, esophageal cancer, stomach cancer.
That is smoking.
Liver cancer, yes. Cervical cancer, that is smoking. Throat cancer. We also see cancers that primarily poor people get, like in Uganda, all right? Because their conditions, and by the way, of living are poor. One of the ways to fight cancer, you need a good immunity.
Okay, but just tell us what are those cancers that poor communities are prone to getting?
We mentioned Burkitt's lymphoma.
If you can't access quality, safe malaria drugs.
Exactly. You cannot treat malaria.
That's a function of poverty.
Yes, you cannot treat malaria. You cannot afford a mosquito net, okay? Your child is being bitten by mosquitoes every day. Suffers this week, next 2 weeks, gets another bout of malaria. You do not get adequate treatment promptly. Malaria is a disease you need to treat in the first 24 hours. If you go beyond the first 24 hours, you get severe symptoms. It will put you down. If you interrupt this malaria within the 24 hours, take some treatment, you will come out quickly. So that is poverty. So Burkitt's lymphoma, primarily here in Uganda, we see it among the poor. All the children that we receive, we never receive a child living in Kololo, Nakasero, no. Most of the people we receive, we talked of Mayuge, Kumi, Palisa, those are the areas where most of these children are coming from, okay? And if you map those communities where they're coming from, indeed they are not well-to-do. So that is one cancer associated with economic or social status, you know, that kind of thing, or empowerment or income in the family. We also do have certain cancers that are primarily in certain communities. Cancer of the liver in Uganda is primarily, we find most of the majority of patients come from West Nile. But they also have, the cause is hepatitis B. So you find that hepatitis B in that communities, and we believe that it's because of the practice, the way the people, they have this traditional treatment where they cut and put medicine.
Oh,
Therapeutic.
the scars.
Yes,
they are fashionable for them.
There's
It's
some
part
days-
of cultural identity, I think.
Exactly. So you find it is usually done by one person on the village. So he cuts everyone. He uses a sharp razor blade. As he cuts, he also gets cut. So the blood flows from him to the cut wound, and that's how they spread that.
And that can
virus.
cause liver cancer.
You eventually you get the virus stays in your body for over 20 years, and you get the cancer in the liver.
Okay.
So
What
that's-
about the food, the sim pest, the groundnuts?
So the aflatoxin, okay? So aflatoxin is a well-known cause of cancer. Not only cancer of the liver, but cancer of the esophagus and other cancers. And you heard about this debate between Uganda and Kenya and selling
The
maize.
aflatoxins, yes.
What we know is there is a lot of aflatoxin across the border, indeed, because they are maize eaters. Okay, they eat a lot of maize. But in our setting also, we do have a lot of aflatoxins. And this is where I should emphasize. You lady in Nakawa, you know Nakawa is one of the biggest markets here that sell Simpson
Vegetables and
and groundnut pest and Simpson pest. Okay? So what our people do is to shortchange. That's another way of doing counterfeit things. They get the small G-nuts. You know the smaller ones? The ones that, those are the ones most affected by the aflatoxin.
by the aflatoxins, yes.
That is the one they grind to sell. Because you cannot sell the smaller ones, no one will take your G-nuts. So they pick out the smaller ones, and those are the ones they grind, and those are the ones that are affected. And that's what the paste you buy. So you buy the paste and take it home.
And
Okay?
eating that food over 5 years, 10
Yes,
years
so you're
eventually.
eating pest infested with aflatoxin. Because the lady in the market, in the Nakawa market, for example, has no idea about aflatoxin in those groundnuts. She's trying to shortchange, but she also consumes the same, unfortunately.
Before we are accused of concentrating on only one side, you
Yes.
say there is cancer caused by poor conditions of living.
Yeah.
I'm sure people want to know, are there cancers that are common to people who have a good standard of living?
Correct, indeed.
Which ones are those?
So we all know things like prostate cancer, colon cancer. We used to call these cancers of westernization, and they were common in those countries. But remember that our standards of living have improved over time. We're no longer the people who used to live in the village. We're now city dwellers. We drive cars. We used to walk long distances. That is not the case now with our younger generations in Africa. And so our great-grandparents lived in the village. They ate everything organic. They never had fertilizers. So they never had these pesticides with their chemicals that cause cancer. So they ate everything green, organic, as we call it. But now we drive cars, so we don't walk anymore. We eat well, so we put on more kilos, all right?
Weight
Weight,
is also a cancer-causing factor.
obesity, we call that obesity.
Obesity is?
Yes, obesity is a risk factor for most cancers,
Which type?
including breast, including colon, including prostate, okay? Obesity, even cancer of the esophagus as well, cancer of the pancreas. So obesity is one known cause or risk factor for cancer. And it is also a well-known risk factor for non-communicable diseases, so the NCDs that you hear about. Hypertension, diabetes, and cancer. So you live well, you eat well, you put on more kilos, no exercise, you do not eat any antioxidants in these fruits and
You're at
vegetables.
home, you don't move to switch on the TV.
Nothing,
there is a remote.
everything is in the chair. You drive back, you have a driver, they drive you back, take you for breakfast, take you for
You
lunch.
have sugar in everything you eat. Is
too
sugar
much.
cancer causing?
Sugar will predispose you to obesity. Actually, well, most cause of obesity is actually carbohydrates. You know, the carbs, they call them the carbs. So the carbs will help you put on more kilos than any other thing. So the carbs, that sugar you take in the Coca-Cola or the Pepsi-Cola, or, you know, in the ice cream, or in the smoothie that you're taking, or, you know, whatever, that's those sweet things. You pile up, you put on more calories. And the more you put on more calories, the more the body begins to function abnormally.
So doctor, is that why we see a lot of people these days running, all the hills of Kampala,
Yes.
people running? Is
Which
there
is-
something that physical fitness and exercise
Very
do
important.
in preventing cancer?
Very important. So in cancer prevention, we have a whole lot of things. One of them is exercise, 3 days a week. Each exercise must at least spend more 20 to 30 minutes. Your breathing must be faster while you do the exercise. Your heart must beat
How
fast.
does that stop cancer?
So it improves your, first of all, circulation, all right?
Blood.
Increases your metabolic rate. When your metabolic rate increases, you burn more fat, all right? So when you burn more fat, you're cutting down on the weight, all right? And you're cutting down on obesity. We want you to to keep a lean body, okay? When you take the greens, the vegetables, the fruits, those have antioxidants. Those antioxidants is what helps the small, tiny metabolic activity within your body to function normally and break down and then get rid of toxins within your body. When you take vegetables and fruits, they have a lot of fiber. So there is a cleansing effect they have on your colon. As you cleanse your colon, your risk of colon cancer also goes down. So you can see it has a multiplier effect. It's basically does many things. If you avoid alcohol, alcohol is another risk for all these NCDs, including cancer, diabetes, and hypertension. If you take, the less alcohol you take, the better for you. The more alcohol you take, and the type of alcohol also matters.
But Jesus served alcohol, some
Yes.
wine.
Yes.
Meaning, I think some wine is good.
I
Actually,
think-
some people say a glass of wine after a meal is
I
good.
think-
Is the
think-
Cancer Institute saying we should
I think
not
that
take wine?
it is a bit challenging. You know, I think that there are people who take some wine, but it's difficult if you're a wine taker or alcohol taker to know how much you should take.
If you are not high,
If you're
I
not
think
high.
that's how you know that it's still okay.
Possibly, I don't know how you can control things with alcohol. I don't know how people control that. It's a little tricky.
It's a
But
little
generally,
tricky.
if you can keep away from alcohol, the better.
The better.
When it comes to meat, does meat predispose you to cancer? Yes, you need a little meat in your body because it helps you. It has
Protein.
iron. Yes,
And iron.
iron, vitamin B, it helps you to form blood and that kind of thing. But have organic meat, in other words, not processed, and then less fatty, and do not fry. Have it boiled.
Doctor, we are running out of time, but
Yes.
there is something that is common
Yes.
with this disease. Some people will be diagnosed even early enough with cancer,
Yes,
and then they go on treatment,
yes,
and then the cancer after 10 years or something recurs.
yes.
The question is cancer a curable disease?
So,
Can it cure and never come back?
yes, cancer can be cured. The most important factor that determines whether cancer, there are actually three main factors. Number one is the type of cancer. There are some cancers which are bad.
Like,
Whether cancer of the liver is a bad one. Whether you go to the US or you go to Europe to get treatment, once it is in the advanced stage, it will not get cured. So there are some bad cancers. Cancer of the pancreas is bad. Cancer of the stomach is bad. These are all bad type of cancers. However, The other most important,
Which ones are
factor.
not the very bad?
So Burkitt's lymphoma that I mentioned is a curable cancer.
Okay.
Almost 90% of these children we talk about can get cured. There are cancers like seminomas that are cured. There are cancers, some cancers that affect the uterus, especially in women who are childbearing, are curable. Okay? So there are some cancers, world over 50% of cancers can be cured. But the most important is the stage of the cancer. So cancers, when it is early, like stage 1 and 2 are considered early, cure may be possible. When it's late, stage 3 and 4, cure is usually difficult again.
It's usually difficult.
So that is the most important factor that determines who gets cured and who does, is the stage, how far it has spread.
Doctor, this is an anti-counterfeit show, a
Yes.
show promoting genuine. But as we wind up, we have also fakes
Yes,
in medical services. We have a lot of fake doctors.
correct.
How is this contributing or complicating the management of disease, cancer, and all others? Do we actually have fake doctors?
Tell you what, we have had people arrested here within this hospital.
In the
Mulago
Cancer
complex.
Institute?
Yes, even cancer, Mulago Hospital Complex, faking as doctors. Because this is a big place, there are many doctors and you cannot know all the doctors.
And you
working
need to
here.
just wear white.
Yes, all they do is just wear white. And they pounce on our unsuspecting patients and flinch them of money. There was a man who counterfeit. He said he was Dr. Okuku.
You.
Yes.
He looked like you.
I don't know how he looked to this patient. The patient was referred to me.
And he found somebody
No,
who
he
hijacked him.
he found a young man at the gate. So he asked the young man, I have been sent to see Dr. Okuku. Unfortunately, that young man was a fake. He pointed to a certain fake guy.
So there was a fake guide at the gate
Yes,
who connected him to another fake.
another fake guy who took his contact, and then they were in touch and took money from him and kept telling him, oh, I have gone to Saudi Arabia, I'm going to come back next week. So the man's ill disease continued to progress. And he said, but what kind of doctor is this? Who never comes? He's in Saudi Arabia, he's not coming to see me.
Maybe he's one
So-
of these guys who
so
go to
he
look for
says,
jobs,
Let
domestic.
me go and ask at the Cancer Institute and let any doctor see me. That's when he discovered that he had been seeing a counterfeit. So counterfeit
is an issue.
it's a
Doctor,
big
we are
issue.
out of time, but
Yes.
I see some gadgets here.
Yes.
If you can help to explain to the viewers, each of them,
So
what is
this-
the gadget and if it is a counterfeit,
Yes.
does it
So-
complicate?
So this gadget is a blood pressure machine. It's an automated blood pressure machine. You cannot start pressure treatment or hypertensive treatment without having your pressure taken. So the doctor will need to take your blood pressure. And if the machine is a fake, it will give you possibly a low pressure when you have hypertension. So the doctor will not prescribe the drug.
And say that you're okay, then you collapse.
Then you get a stroke or you bleed in the brain because you got a fake machine.
Are these things capable of being faked?
Of course. They
So
are.
some people are counterfeiting this.
Of course. And this is the challenge we have in this country. We import everything like this. And so we have no way of knowing that this machine, pressure measured on this machine,
Is correct.
can be transferred to another machine. It's in the same range. So when you have a fake one, you will actually not know. So this is how dangerous it is when you have fakes in the medical area.
So
in the medical
we
field.
have fakes in medical equipment
Yes.
as well.
So this is an interesting one. This machine is called a pulse oximeter. Pulse oximeter. So it measures your oxygen levels in your blood. Okay? So this is the probe. Okay?
So can you, is it on?
I think it requires to be
I
powered
want to
on.
see if I have
Yeah.
oxygen. Or,
It's required to be powered on, but
okay.
this is the probe. You put the finger in there, and then it measures. So during this corona pandemic, this has been one of the most important gadgets in the hospitals.
Because when you have corona, you have issues of oxygen in your blood.
The doctors have got to monitor your oxygen levels. So if you get a fake pulse oximeter and it says your oxygen is okay, then the doctors will not administer oxygen to you through the nose.
So many of the corona deaths in Uganda actually.
So you could actually die from corona because they said, "Look, but the oxygen is okay, you know, the thing is saying." Or if a patient is beginning to develop the worsening symptoms of corona, and you go to a health center and they find that, oh, I think he has enough oxygen, then you may not get referred in time to a hospital. You know, because with corona, you know, things can turn in 24 hours. A guy who was walking is now admitted because the oxygen just falls down.
And he has collapsed, organ failure and everything.
Exactly.
So I think really, Doctor, you have done a fantastic job trying to show us the concealed dangers of counterfeits. And I'm sure those who have just tuned in or who have watched this program, if you had any doubt that the counterfeits we keep saying are dangerous can actually make a bad situation worse, this is really proof. And Doctor, we really need to thank you for the very articulate and elaborate explanation that you've made. Dr. Fred Okuku is a consultant oncologist here at the Uganda Cancer Institute. Some people may want to know your contact. You're free to tell us because you are a person saving life. How can people reach you?
Well, you can reach me here at the Cancer Institute. And my contact is 0772 485172.
Okay.
I also do my clinics here. If you want to consult with me here, every Friday I run a clinic here where I see my patients who have cancer or those who want to check for cancer, and also every Wednesday I see patients. So you're all welcome.
Your last word on counterfeits.
Oh, so ladies and gentlemen, counterfeits in the medical field is a dangerous thing, and this could happen to your grandchild or to your close friend or relative. So we all must come up to fight counterfeit drugs, counterfeit medical equipment, counterfeit, you know, things in the medical field. And do not assume that you can change that expiry date on that drug. Because it's not going to be swallowed by your close relative, or you never know, the person going to swallow that could be the next professor of medicine who will save.
To add to the 20 for cancer we have.
Yes. So you never know who is going to take that medicine. It might destroy his liver, or might destroy that child's brain development, or might lead to that child suffering cerebral malaria because you are selling a counterfeit anti-malaria drug, and that child will grow with a brain damage and be retarded in future. So that's how counterfeits affect us.
So basically, Doctor, you're saying avoid counterfeits. This is the League of the Genuine show. Correct. Everybody should belong to this league. Yes. Please don't belong to the League of the Fake. Yeah. There is only one league that any decent person should belong to. We really need to end it here. Thank you again so much, and thank you to the Uganda Cancer Institute. We would like to leave it here. We hope this information conversation we've had has been of help to you. We are hoping to host you again because I feel you had too much, but they said too much of anything is not good. So for this episode, we really need to say bye.